So, hello everyone. I am Senator Roxanne J. Persaud, representing the 19th Senate District. I'm also the chairperson of the Senate Social Services Committee, and the committee that I keep saying to everyone is the most important committee because we are about uplifting the lives of all New Yorkers. I'm here today to have a conversation with Carolyn Sheridan, Associate Director of State Policy at the National Organization of Rare Diseases, or as we say, NORD, and an advocate and mother of a child with a rare disease, Geana Dyer, to discuss rare diseases, policy, resources, and advocacy. It's a very important topic. It's something that's not usually spoken about. And when it came to light for me a number of years ago, and so we wanted to continue having the conversation. We've introduced legislation about the rare diseases, et cetera, and we've done resolutions on the floor acknowledging rare diseases, advocacy days, etc. So today we're going to be talking about all things rare diseases. And I'm going to start by first asking each of you to introduce yourselves and share with us how you came to be in the space you're in. So we're going to start first with Carolyn, and then we're going to go to Geana. So Carolyn, welcome.
Yeah, thank you. Hi, Senator. Thank you so much for having me with you today. My name is Carolyn Sheridan, and I am proud to serve as Associate Director of State Policy at the National Organization for Rare Disorders, or NORD. In my role, I'm responsible for the development and implementation of NORD's state policy efforts to improve the health and well-being of people living with rare diseases and their loved ones on the state level, all 50 states plus Washington, D.C., as well as our territories. I joined the NORD team about 3 years ago, following a really rewarding and exciting, but maybe a little tiring time in the New York State Senate. I worked for the Majority Conference for great senators like Senator Persaud, serving as a subject matter expert on the committee level for health, the Addiction and Substance Use Disorders Committee, and the Women's Issues Committee. I'm really kind of particularly proud of the work that I did during the peak of the COVID-19 pandemic, keeping members up to date, and the role that I had in helping to negotiate 5 consecutive New York State budgets. But I grew up in Western New York. I'm the middle of 3. I have an older sister and a younger brother, and public service runs in my family. My grandfather is a retired New York State Court of Claims judge. My father just retired after 32 and a half years with the State Transportation Department. My mom is a public school teacher. My brother is a public school teacher, and my sister works at a state-run retirement home. So I knew that I wanted to work in public service, and I was drawn to the policy world. It has felt like I was sort of headed to the rare direction for quite some time. In high school, my mother was diagnosed with a rare disease called Addison's disease. Her adrenal glands don't work. So for my undergraduate thesis presentation, I did my project was focused on the cell signaling pathway for my mom's rare disease. My first adult job was with the Senate in 2019, and one of the first bills I ever worked on was New York's Rare Disease Working Group, which we're now working to codify with Senator Persaud's championing. And then just as I was starting to work at NORD, I was diagnosed with an autoimmune rare disease myself. My platelets don't work. So when I was ready to move on from the legislature, there was an opening at NORD that just aligned so perfectly. And it really felt like this was where I was meant to be right now.
Thank you for that. Thank you for that story.
Mm-hmm. Yeah. That's a lot.
So,
that's
Geana?
Hi, I have to call Carolyn. Thank you for sharing. That's like a lot. That's a really amazing story. Now I'm like, oh gosh, I need to say a little bit more. So my name is Geana Dyer. I am a registered nurse by trade. I call that my paid job. My non-paid job is working for the Cockayne Syndrome Foundation. It's a nonprofit that I started a couple of years ago. We are currently in the process of partnering with another organization called the National Initiative for Cockayne Syndrome. In 2020, they created healthcare manuals for caregivers and providers of children with Cockayne syndrome. So with their medical education and our services in sending out symptom-specific supplies, I think we're going to make the future even better for kids like my son, Ronan. So I have been a nurse for getting close to 10 years. I'm about almost at 9, so I'm just going to lean toward the 10. I've been doing ICU, and I'm currently working in the emergency department at my local hospital. I came into the work in rare disease because of my son's diagnosis in 2022. He missed a lot of milestones, so we had ended up going through our diagnostic odyssey and finding that he has the rare disease Cockayne syndrome. It affects 2 in every 1 million births. It is a neurodegenerative terminal disorder with no cure. It impacts DNA repair. So the children's maximum life expectancy currently is 12.4 years. With advances in medicine, we've been able to have kids live longer than that. But over time, they lose their vision, their hearing, their abilities to speak and walk and swallow, and they develop dementia in the second decade of their lives. It's very common. So once I became part of this community, I realized that there are a lot of gaps in care and trying to identify what services we can receive either through our state, county, or even the city that we live in. Every state is unique. So trying to identify those things is a struggle, on top of developing our individualized education plans at school and working with the school systems, and then trying to find durable medical equipment and different resources like that in the community and beyond, essentially. So we just wanted to, I say we, as in my foundation, we want to just make it a little bit easier for families, because we're already struggling with this concept that we will outlive our children. And that is very challenging to experience. But then on top of that, navigating all of these different services and different aspects of care that you just never expect to have to do is another challenge in itself. So that's why I'm here. And NORD is a really humongous advocate for all of us here in the United States that live with someone with a rare disease or have a rare disease. So they were my go-to organization that I wanted to link up with to just kind of help each other make life better for kids in the rare disease community and adults as well, like Carolyn and her mom.
Well, thank you for that. How old is your son?
He will be 6 next month. So it's going to be a big birthday because it's, the halfway mark. So it'll be a bittersweet celebration, but everyone is special. So
everyone will be a special celebration.
Mm-hmm.
And you know what? Miracles can happen. You never know.
Yeah.
You never know.
No.
So thank you for that.
Yes.
So I'm going to ask Carolyn, what is considered a rare disease? And then Geana, if you can tell us, I know you've been doing your research and you're working with NORD. And so both of you can talk about, rare disease and how many rare diseases are there currently. We know that, they're being discovered, uncovered, often. And so Carolyn, we'll start with you. What is considered a rare disease?
A rare disease is defined for us under federal law, under the Orphan Drug Act, which was enacted in 1983. It is within that legislation that it lays out a rare disease in the United States is any condition that is found within 200,000 or fewer individuals. NIH estimates that comes out to about 1 in 10 Americans, or about 30 million of us. And we are now at a point where we have identified at least 10,000 known rare diseases.
Okay. Can you tell us, other than cocaine, some other rare diseases that's out there that we've never heard of?
Yeah.
Go ahead.
Yeah. Oh, sorry. I was like, oh, I got one for you. Yeah. Another one is trichothiodystrophy, which is a sister disorder to Cockayne syndrome. It also is it's also a DNA repair defect. Gosh, that's the first one I thought of. Carolyn probably
it's amazing how it just rolled right off your
It really tongue. Did.
I know, right? TTD, yes. Well, I mean, the families that I help them too. So we help the kids with Cockayne syndrome and the kids with trichothiodystrophy because a lot of their symptoms overlap. And they are even more rare. It's 1 in a million kids that have this disease. So it's, we're barely scraping the surface with research for these kiddos. So being able to represent them as well today is very exciting. Thank you for that question. Okay, Carolyn, take it away.
Carolyn, I still can't get over how she just flowed.
Right? It was great. That one definitely sounded genetic in nature as well, which makes a lot of sense. We do know that a large majority of rare conditions are genetic. I believe our latest statistic is about 80%. Other rare diseases folks may know, sickle cell disease is considered rare, ALS is considered rare, hemophilia, and all pediatric cancers are also considered rare.
Wow. Mm-hmm. Well, thank you for that. So tell me, what would you say are some of the biggest barriers that individuals with rare diseases face when they're trying to access the care that they need?
I would say navigating a healthcare system that was not built with them in mind at all. So in medicine, there's actually an old adage, a teaching adage. When you hear hoofbeats, think horses, not zebras. Mm-hmm. So our medical practitioners are being taught that when you're hearing hoofbeats, when you see symptoms for something, think of the most common cause of that being presented. Don't think of the exotic or the least uncommon answer. And I think that has its place in medicine, but we know that in the rare community, we are the exceptions, we are the niche and the exotic, and we are the zebras.
Mm-hmm, mm-hmm. Mm-hmm. And that, to me, this is one of the biggest reasons why, and I didn't realize until I started working in the emergency department, I'm grateful to be there because that's all we're hearing are those hoofbeats and thinking horses. But I'm there to be like, wait a minute, this could be a zebra, and it's only because of my experience that that's something that I bring to the table that's unusual, unique, and like a little secret advocate. I didn't realize it was an advocacy opportunity for me. Because exactly like Carolyn said, it's a humongous lack in provider awareness, and it's not and that's why it's so important for us to have our rare disease advocacy committee, because at least we could have at this higher level some voice that's speaking on our behalf, because a lot of providers just aren't thinking about that. And on top of that, then there's the difficulty in accessing the care because a rare disease requires specialty services, and those aren't there everywhere. For example, I'm in way upstate New York, in Plattsburgh, New York, and all of our specialty services are in Burlington, Vermont. So we go to Burlington to see all of our specialists. And that's about an hour drive for us with a ferry in between. The next closest would be Albany. And that's about a 3-hour drive for us. So yeah, that's definitely a big challenge for us too.
Wow. So we have worked on the legislation that I put forward to create the New York Rare Disease Council, the Advisory Council. and NORD has worked with us on that. As you know, the bill passed both houses. We're happy with that. Can you, Carolyn, tell us of something that, the importance of this council?
Yeah.
Why do you think it is, and the role that you see it playing in improving the lives of those who are afflicted with a rare disease?
So I think state level policy has been finally getting its due time in the sun. I think all of us know how cool it has always been. And we all know how many healthcare decisions are made at the state level. State governments regulate the health insurance industry, provider scope of practice, telemedicine, Medicaid programs, you're administering newborn screening programs. And these are state embedded advisory bodies. And we have seen these councils give the community more of an opportunity to have a voice so that elected officials can consistently hear about how certain policies that impact the rare community can be improved or tweaked or maybe need to be put forward in the first place, and just ways that they can better meet the needs of their rare community. So rare disease advisory councils across the country, there are now 33. They act as that consistent platform for the community to share their story and implement positive change.
Well, thank you. Thank you for that. And, we'll continue. I always say the voice of the community must be part of the decisions that we make. And too often we don't have the voices when we're making the decision. So, hence us working to ensure that the council is there and that we can hear the voices of those, like Geana, the people with the lived experiences. We want to make sure their voice is part of the decisions that we are making. So thank you again for that. So tell me also, what are the types of changes you would like to see in the rare disease policies that we're putting forward? And I'll start with Geana and then go to Carolyn, and because you're on the NORD level, but Geana is the parent who who's living this every day. And Carolyn, now thank you for bringing your story to us now. But Geana is living it as a caregiver, but also in the medical profession that she's in, and she's seeing the things that are needed. So tell us, what are some of the policies that you think we should address?
Oh my goodness. I might get a little nitpicky, but and then Carolyn can be more of the broader strokes, because she will balance each other out. A couple of things that I look at is one, the NORD has what they call the NORD state report card. So one of the things that I'm looking at, a couple of them, medical nutrition, we get a B, which is pretty darn good. But it made me think personally of my son who gets tube feeds, and Medicaid will cover synthetic formulas like Cape Farms or different protein mixes. But I do a whole food blend for my son, and that doesn't get covered. I mean, it's just a little nitpicky thing that I experienced in my own life. But other things that we have talked about before is out of state care for insurance coverage is something that's humongously needed for rare disease, because, for instance, the doctor that is kind of like nationally recognized, but on top of that, internationally recognized as a specialist in Cockayne syndrome is in Minneapolis, Minnesota. So whenever we go see him, we have to pay out of pocket, despite having primary insurance and Medicaid for our son.
Wow.
Yeah. And so that's a big one for us. And telehealth is a little tricky as well, because that sometimes is out of state. So having some policies that help ease that financial burden would be incredible for us. And And another one that's unique to me, and I've been advocating for this since last year, is there's a bill that we're working on with the Department of Health that's about complex care assistance. So a lot of states have the programs for parents to be paid as complex care providers for their children. So it's a supplemental. It's a way to get paid essentially to care for your child, because as a parent you want to be a parent, but we spend so much of our time providing care to our children. A lot of us don't work. I had to step out of my career for a couple of years. I started the nonprofit while I was doing it, just to get my son's care all kind of straightened out and figure out if he was safe to be able to go to school and have his own life outside of home. I was still applying my nursing skills, but because we don't have any policies or programs in our state for parents to be reimbursed for caregiver duties, I essentially left the workforce to care for my son, and the bills are getting higher, right? Like he gets sicker and we get poorer. And so on top of dealing with all of the emotional burden and the navigating of care, there's that financial burden that falls onto the parents as well. And that's a whole other conversation for another time, but it's a humongous gap for families like mine. Luckily, my son does not need nursing care at home, but I have a lot of friends that do. And they're struggling out there financially while still just, trying to keep their children. Yeah, exactly. So as I said, nitpicky.
No, it's not. You're advocating. That's it. Yeah. You're advocating. Yeah. So thank you very much for your advocacy. Yeah. And so we're going to go back to Carolyn.
Thank you, Geana, for sure. Yeah. Oh my gosh. So I think I have two. One of them falls within NORD's areas of our state report card, and the other one is not yet on the report card, but might have its due day. So for over 10 years now, we're on our 11th year. NORD has issued our state report card, where each year, it's a snapshot in time, we evaluate the existing laws and regulations that are on the books in each state, and issue a grade, an A to an F. Some categories are pass-fail as well. But those issue areas all fall within state policy areas of jurisdiction. And overall, NORD, New York is a pretty strong performer, coming in at a B overall this year. However, we do see some gaps, and they relate almost exactly to what Geana was talking about. And one of them is New York is not a participant in the Interstate Medical Licensure Compact, or the IMLC. I think there are very understandable reasons for that. We have seen a lot of states making laws with sort of extraterritorial reach that can create a chilling effect on the IMLC. However, it has proven to be a useful tool to help streamline physicians being able to practice across state lines. And out-of-state care is one of the most commonly utilized practices for rare disease patients, because specialists are just located everywhere. The other gap that I see is exactly what Geana was actually also talking about. She has to go out of state, so that gets at our IMLC issue. But when she goes out of state, she also has to access care that is considered out of network. There was a bill that was signed into law in the state of Minnesota that was created by their Rare Disease Advisory Council that went into law in January 2025. So it's just had its first year of enactment. That is called their Network Access Law. And this law effectively eliminated the concept of out-of-network care for a rare disease patient and for a potentially rare patient, someone who is on their diagnostic odyssey. that is an incredibly difficult population to capture in policy. And so and the fact that that bill was passed in Minnesota, the health insurance capital of the world, is mind-blowing to me. And it's really, really exciting to say that we actually do have similar legislation pending in New York State. A2384A, with its similar bill S965A, would provide a similar type of out-of-network coverage protection here. But it does need a little bit of help getting nudged along, and it does need a strong champion Senate side, because the current sponsor was just recently elected to serve as Manhattan Borough President.
Manhattan Borough President.
Yeah.
So who are you looking at new members, speaking with new members? Have you spoken to the chair of the Health Committee?
I have not yet. We are trying to focus on really championing the RDAC bill first, and then seeing if we can pick up another great champion. Wink, wink.
Okay.
And we would love recommendations / support.
Recommendations are always good. They're always good. So one other thing I noticed is that more than 90% of rare diseases are still without FDA approved treatments. Can you speak on that? And what is, the federal government recognizes these rare diseases. Why are we not receiving fast approval from the FDA in treatments?
Yeah, so the United States has a strong evidence standard for FDA approval of drugs and biologics. That is the safe and effective standard. But in the rare disease community, you have a confluence of conditions. You have limited understanding of biologically of these conditions. You have challenges running clinical trials because the patient population sizes are so small. You can't get to an epidemiological, meaningful null value. And then you have a small market size, which results in a limited cost of return. And we do operate on a system that creates it as a business mechanism. Right. So those conditions all make rare disease drug development an unappealing space for sponsors or the manufacturers to conduct research and development. That was the impetus for the Orphan Drug Act being signed into law in 1983, and it has worked. Before 1983, we only saw 38 drugs to treat rare diseases. But as of today, the number that we have now is that we have 1,405 orphan indications. So we're seeing that these incentives from the ODA are working, but there's definitely still more work to be done. Even as recently, we're seeing the plausible mechanism pathway being proposed to kind of try to get us into the next era of cell and gene therapies, and how can sponsors navigate existing frameworks to, maybe try to accelerate hope a little bit.
Well, thank you for that. And, thank you for explaining, the process on the FDA and why. Because we talk about, there's some other diseases that are no longer considered rare. And you're saying they've been testing for so many years, and we still haven't found cures or the perfect drug as yet. And so we understand that. I'm hoping that with the changes that the FDA and their approval process, that we don't fall further behind. Yeah. With the challenges that we're facing currently with them. So, you do know this, that rare diseases are not well understood or researched, which can lead to many patients being without sufficient information and communities being without information about their symptoms, etc., and treatment. You hear, for example, someone with sickle cell, they're considered seekers, right? Because they're going there and people are not understanding, the pain that they're going through. And when they're looking for medication to temper that, the pain, and etc. I have some cousins who are, sickle cell, I have a cousin whose young son actually passed, from it, because they weren't getting the treatments, etc. And it depends on where you are, the communities that you're living in, that you'll have access to at least the best treatment at that time. Can you talk a little about, the influences or lack of influence and the lack of information when it comes to people understanding rare diseases? I know I said a lot.
I can. Yeah. From personal experience and from what I hear from our community, the Cockayne syndrome and trichothiodystrophy community, is parents are the professionals. Parents are the experts, and if we are not listened to, we do encounter, very similar to your family member, very negative, poor outcomes, right? Because, parents are not viewed as, we're just viewed as, lame and just the parents.
Not taken seriously.
Right? Yeah. But really, we live it every day. And that's why organizations like NORD and like the Cockayne Syndrome Foundation, that's why we are created, and we work so hard to try to advocate for these communities, because if we what is the motto of NORD? Alone we are rare, together we are
strong.
There it is. It's right there. Yes, exactly. And without our organizations, the voices of these folks are just not heard. And there's delayed care, there's misdiagnosis, there's inappropriate treatments. And so if we're able to provide the education for the families and healthcare providers, it really it's critical to improving outcomes of care for our communities. So yeah, that's
all you can do, right? Yeah. So for both of you, Geana and Carolyn, what are some of the most effective strategies that you've used during your outreach when you're talking with people about rare diseases? And how often are you really coming out and having public conversations about rare diseases so that the public becomes better informed?
Yeah, so I talk about this almost on a daily basis in every aspect of my life. And usually what I end up leading with whenever I'm going into a conversation with somebody where I'm assuming zero baseline knowledge at all, I will lead with sort of NORD's main tagline, alone these diseases are rare, but we're talking about 30 million people here. We're talking about 1 in 10 people. And I will often then list a few of the more common or well-known rare diseases. I'll say ALS is considered rare. I'll say rare cancers in children are all rare. And I will kind of come at it from that way, and then start to kind of get a little bit more narrow and talk about the shared challenges that each individual disease state experiences that makes it a wider unified community.
And for myself, our nonprofit, I do speak about rare disease very often. At work, I feel like, every couple of shifts, there's a little kiddo or someone who comes in with a rare disease. And again, we're thinking it's horses, but I'm like, wait a minute. Have we thought about some other things? So at work, but then we also have our social media. So I share a lot of different little stories about my son on TikTok, and we gather up pictures of our kids and share little videos about them, and just kind of like expressing that just because these are rare kids, they're still kids and they're still part of our community, and we have unique challenges, but we still exist and are worthy of love, care, and proper medical treatment and recognition. So I do a lot of that stuff, and I've been doing a couple of speaking opportunities here and there, and just every opportunity that I can to be able to share my story, my son's story, and my community's story. I grab a hold and join. So,
well, thank you for that. You know, finally, we're in a society where you talked about, ALS being a rare disease. I had a coworker who, I watched her disease progress until, she's no longer with us. But ALS has another name that's attached to it. We live in a society that when someone famous is afflicted with a disease, then it becomes the talk of everything. Then resources are poured into it. Yes. I remember in the days, the AIDS epidemic, and when a name was attached to it, everybody talked about, ALS when the name was attached. Well, what are we doing to ensure that that we do the same in this space? That when we know of a prominent person, we ask them to be a spokesperson, not just only for their particular disease, but for the rare diseases in general, so that they can shine the spotlight on the issue of rare disease and why it's not, in everybody's conversation. What are we trying to do to encourage those people to be part of this?
I think the initiative that stands out for me most with that is our International Day of Awareness, Rare Disease Day, which we take advantage of every year. It's a really, really big, exciting time. It falls on the very last day of February every single year. Yep. And that is because in the leap year, it would fall on the 29th, the rarest day of the year.
Day of the year, yeah.
So we just celebrated it, and that is our International Day of Awareness. That is our big call to action to show your stripes. We have champions like Senator Persaud introducing resolutions in state houses across the country. And then we have our global partners doing the same thing in European Parliament and in the governments of Spain and Germany and Italy. And it just becomes an international day of awareness. And it really kind of helps break through and build momentum for that we can then run on for the remainder of the year and kind of really cultivate champions who are going to be able to speak on behalf of the entire rare disease community, maybe not just one particular disease state.
So who do we have right now as our international spokesperson that's speaking rare diseases? So if I do a search and says, rare disease spokesperson, who can we say is that person who's speaking up? Do we have one?
No, I don't think we have one person, do we?
I know that there are celebrities with rare diseases, right? Like Celine Dion comes to mind for me.
Right.
But I don't know that we have like a spokesperson. The National Organization for Rare Disorders. And NORD.
NORD, yes.
NORD.
Yeah, it's interesting. When Celine Dion, when I was like, what is stiff person syndrome? And then you're hearing all these stories, and I'm like, oh my God, that can actually happen. Someone's body just locks, and you need assistance for everything. But then again, you're not hearing in the public. You're not hearing a conversation highlighting that, right? And so I see it at that. It's selective in the diseases that people want to highlight. We don't have one consistent messenger that says, listen, there are over 10,000 rare diseases. These are the things that we need to focus on. These are the things we need so that everyone understands the needs within the rare disease community. We don't have that. And I think we need to start working on that, getting that message out.
Yeah.
When, we have a pamphlet for this, but we're not putting the pamphlets on rare diseases in every doctor's office, in every medical clinic, those kinds of things. And I think those are some of the things, that's just me, that were saying that we
Well,
need to start having those.
So last week, it's funny you ask, who is our famous person that can do this for us? I just met some folks from Hunter's Hope, which is another nonprofit in New York. It was started by Jim Kelly, the quarterback from the Bills. I hope that I'm not wrong.
The Bills.
Yeah.
Carolyn.
20 years ago, I think. And Krebs leukodystrophy is what his son had. And so they, instead of just Krebs leukodystrophy, they advocate for all leukodystrophies in the United States and have been creating leukodystrophy. It's called the Leukodystrophy Care Network. And they have various different clinics throughout the country so far. It's in the teens. I can't say the number exactly. But Anna's going to be upset with me because I don't know the data point. But at any rate, that's the first person it made me think of, because instead of just focusing on his son's singular leukodystrophy, he's helping all of the children that have leukodystrophies. And I think there's over 50 types of leukodystrophy. So that's the only one person I can think of that's advocating for more than just one disease. Yeah. I mean, even the Cockayne Syndrome Foundation, we advocate for two. So, yeah, I guess NORD's our guy.
NORD's your guy.
Mm-hmm.
And Carolyn still does not have NORD out there.
No, I don't. I'm sorry.
We could get my son's Make-A-Wish dog, Bernie's, our Bernie's mountain dog out here if you want to see one pup.
Oh, yeah. Let's see. So your son will say, you can show it to your son and say, your dog was on television.
She was famous. Yeah. No, she's outside playing in the mud. I'm just going to keep
her. Oh, no, you don't want that. Yes.
Yes. Keep her where she belongs, outside in nature.
I just want to say thank you to both of you for being here today and having this conversation. I hope everyone will learn a little more about rare diseases. Mm-hmm. It is something that it's fascinating. When you hear 10,000 rare diseases, you're like, how do you come up with 10,000 rare diseases? Yes. And then you hear it over and over. Someone was an autoimmune disease and this and that, and then you're like, oh my God, yeah. Mm-hmm. Yeah.
And one in 10, that's just like the most mind-blowing number, because it's literally one of my two neighbors probably also has a rare disease, it's
interesting. Yeah.
Yeah. Yeah.
Yeah. So, well, thank you both again. And Carolyn, what do you want any last message about NORD and the importance of understanding the needs of the rare disease community?
I just want to make sure to say thank you, Senator Persaud, for creating this space for us today to talk about our community and the work that we're doing. Thank you for being our champion in the Senate this year and last year and always, all the time. And I think I would end with saying, alone we are rare, together we are strong. And let's go, make sure when you're out in your community, you're seeing our rare disease community dazzle.
Yeah. Oh, I love that. Yes. Thank you, Senator Persaud. I appreciate the opportunity. Thank you, Carolyn, for inviting me.
Of course.
It's been great. It's been great. Thank you.
Thank you guys again very much. This has been a great conversation, an educational one. And, I want everyone to understand the importance of what we're talking about today. So this has been the conversation with Senator Persaud, as we love to say, and today's topic, rare diseases and everything you should know. So have a great day, everyone. Again, Carolyn and Geana, thank you for being here with us today. Enjoy the rest of your day.